This is a presentation for those people receiving radiation therapy for their breast cancer. Hi, I'm Leanne Danico, a physiotherapist at the Cross Cancer Institute in Edmonton. The purpose of this class is to introduce you to some specific exercises for the shoulder region and also provide some information on the value of general exercise. We will also review some potential side effects that may occur with treatments. This is to help inform you and educate you on how to best manage these side effects. After surgery, you were likely given a booklet such as Your Journey Through Breast Cancer. You can access this online at myhealthalberta.ca or other guidelines on how to start moving your arm again. We expect most people to get back to their normal range of motion after surgery. Now, it's important to start or resume some stretching exercises again, as radiation treatment can cause some changes to the soft tissue being treated. This includes the skin, fascia, and muscles in the area. There is a large pectoral muscle in the front of the chest wall and shoulder that is vulnerable to tightening up a little or a lot. In many of you, it may already be a bit tight just from some of our daily habits or occupations. Tightening of this muscle can change your posture and cause your shoulder to pull forward. These changes can limit your shoulder movements and can be long-standing or permanent. So the goal of the stretches is to lengthen the tissues in the radiation field and prevent or minimize the more permanent tightening effect that may happen. For this reason, we ask that you do these exercises daily for at least 6 months. Because for some of you, these changes are not even recognized until about 3 to 4 months after your treatment is done. For some, this tightening may continue for longer periods of time. These exercises are good for all of us and can be done for the rest of your life if desired. There are a few guidelines to doing these exercises. Stretch to tension and not to pain. You should feel better when you're done stretching, not worse. Tension means perhaps a little uncomfortable. Pain is worse. You're wincing or gritting your teeth, or you have increased pain after you've completed your exercises. Do not stretch this hard. Some of you may have pre-existing shoulder problems. Still try to do what you can, as these exercises may help that poor shoulder. But if pain is increasing, you would need to stop that exercise and seek guidance from a physiotherapist. Move gently into each stretch and hold in a comfortable position for a full 10 seconds. Repeat each stretch 10 times. Most importantly, you need to find time in your day to do the stretches at least once a day. They should take about 15 minutes. If you're experiencing difficulty getting into the position for radiation, you may find it helpful to do your exercises shortly before coming for treatment. As said earlier, good posture is important for good shoulder movement. These two photos help highlight the difference between good and poor posture. Ideally, you want to try to sit or stand tall, keeping your head over your spine, drawing your chin in slightly, and keeping your shoulders open. Purposefully practicing good posture should be done throughout the day. Postural muscles are ones we don't exercise regularly. So if you're at your desk or a computer, try to remember to stop every 20 to 30 minutes and sit tall and pinch your shoulder blades together 4 or 5 times. Now we're going to watch a video of the exercises. I encourage you to pause the presentation after each exercise and try a few repetitions of the movement before going on to the next. The first exercise is a warm-up to get the shoulders and chest wall loosened up before stretching. This is important to help prevent injury or straining the area. It has the added benefit of working some of the postural muscles as well. Place your hands on your shoulders and make large circles with your elbows. Do 10 forward and 10 backward circles. Some of you may feel a few clicks or snaps in the shoulder, but providing they're not painful, don't worry. The video shows our model finishing with a stretch of the front of the chest wall by pulling your elbows back and opening the chest area. This is a good test of your flexibility, and again uses these postural muscles in the back. The next 3 exercises should be done in lying, either on the floor or a firm bed. This allows the focus of the exercise to be on the shoulder to get a fuller stretch. Lying down permits gravity to assist with the stretch while still allowing you to relax into the movement. Lay on your back, bend your knees to protect your back. If you need a small pillow under your head to support the neck, that is fine. Grab a cane or lightweight stick and hold about shoulder width apart or where it's comfortable for you. Keep your elbows straight and lift the stick overhead, trying to get as close to the floor as you are able. Remember to stretch to tension and not to pain. Hold here for 10 seconds, breathing easy. Bring your arms back down to your side. Do 10 times. And repetition number 10 should feel easier and more comfortable than number 1. For those who are experiencing discomfort or can't go back fully on either side, you can support the upper arm with a rolled towel, as seen in the video. You can remove this down the road as your range improves. The next exercise is called the butterfly stretch. You will be opening your elbows up like the wings of a butterfly. Again, lying on your back with your knees bent, bring your hands up behind your head if you're able. You could also put them beside your ears if you can't get them comfortably behind the head. You will then open the elbows towards the floor, allowing a stretch of the front of the shoulder and chest wall. This is a good stretch for that pectoral muscle we talked about earlier. You hold 10 seconds or perhaps for 3 easy breaths, in and out. Relax out of the stretch by letting your elbows come back up. Repeat 10 times. Again, you can use a prop under the upper arm for support, as shown in the video. The next exercise is called angel stretch, as it's like making angel wings in the snow. Again, lie on your back with your arms straight down by your sides with palms to the ceiling. Slowly slide them up along the floor or bed like the arms of a clock. If you can, take them up to the 12 o'clock position at the top of your head. You can hold here for 4 to 5 seconds. Many people find they get the greatest stretch when their arms are shoulder height or a little higher, the 10 or 2 o'clock position. You can move your arms up to the position that gives you a comfortable stretch and hold here for 10 seconds. If you get any discomfort or pain on the top or back of your shoulder, you may be getting some pinching or impingement of small muscles or bursa in the shoulder. You will have to stop or modify how you're doing this exercise if this occurs. You might want to call the local physiotherapist for suggestions on how to modify. You might try focusing more on opening the chest area and improving your posture. Then perhaps try this exercise again later. The last required exercise is done sitting or standing. Sitting is safer if you have any balance concerns. It is a trunk side bend to promote stretching on the side of the chest wall, under your arms and trunk. Start by placing your hands on the top or back of your head. Slowly lean over, keeping your elbows open, and hold 10 seconds. Repeat on the other side. If you find this too easy and want to get a bit more of a stretch, you can reach up with both arms and have one hand hold on to the other wrist. With straight arms, slowly bend over to the side, gently pulling on the arm. Those first 5 exercises are the necessary ones to be done daily for at least 6 months. The next exercise we're going to demonstrate are optional. This next exercise is a common yoga posture called child's pose. It is good for stretching many areas of the body, including the chest wall. But not all of you will be able to get into this position on the floor. And it is unsafe to do this on a bed. As well, those people who have had joint replacements at the hip or knee should not do this. We will show a modified version of this done from a standing position. If you're able, get onto your hands and knees. Take a nice deep breath in before you start. Slowly sit back on your heels and reach out with your arms, letting your head and your heart sink towards the floor. As you are moving into the stretch, slowly breathe out. Do 2 to 3 nice, easy breaths while you're holding the position. Return to your hands and knees. You could repeat this stretch 3 to 5 times. For those of you who are unable to get into the above position, you can get a similar stretch in standing. You will need to be near the counter or a sturdy chair. Reach out with straight arms. Slowly bend at the waist, keeping your head between your arms. Allow a slight bend in the knees to protect your back and hamstrings. And be careful trying this if you have a history of back problems. The last exercise helps with shoulder joint rotations. There's a condition called frozen shoulder syndrome. It refers to a painful and tight shoulder due to changes in the joint itself, the capsule and ligaments. It can happen to anyone, and some of you may have already experienced this in your lifetime. In a small few, symptoms of frozen shoulder can develop after breast cancer and its treatments. With this problem, shoulder rotations are the first movements to become painful and tight. This exercise is helpful with these movements. Perhaps try it at least once to see what your normal is, and this will help you recognize any changes in the future. If you suspect this may be developing, you can start this exercise. But if the problem seems to be increasing in severity after a couple of weeks, you should seek medical advice and may need to see a physiotherapist. So, in standing or sitting, take a towel and hold it vertically behind your back. Gently pull the lower arm up along the spine until a shoulder joint stretch is felt. Hold 4 to 5 seconds. Then, while resting that arm, you can stretch the other arm by reaching down between your shoulder blades while keeping the elbow pointed up. Repeat 3 times on both sides. You do not need to do this exercise 10 times. There are some points to remember about these exercises. You need to stop doing the exercises for a while if there's blistering or skin breakdown. This may occur in some people towards the end of radiation treatments or shortly after radiation is completed. Allow the open areas to heal and then resume the exercises. This may be a few days or a week. You may have a tanning or redness in the radiated area, and that is okay to continue the exercises. Remember, do the stretches for at least 6 months to help prevent or minimize any permanent changes from radiation. And these are our selected exercises, but if you have other stretches you like, such as walking up the wall with the arm, please do them. It is a good idea to do groups of 2 to 3 repetitions frequently through the day for those who are experiencing more tightness. And finally, flexibility exercises are even more important if you're considering having breast reconstruction surgery in the future. The next thing we're going to talk about is general exercise. I'm sure you've all heard that there are many health benefits to exercise. If we could get these benefits in a vitamin or a pill, we would all be taking it, but we can't. Here's a list of some of the proven benefits. There has been a lot of research on exercise and breast cancer, and these benefits translate to you. Strengthens heart and lungs. Some of you may have had chemotherapy drugs that affected heart function. Improves muscle strength. Many patients give up activities and formal exercise when they get a cancer, which may cause muscle weakness and deconditioning. Studies show that it is safe, and you are encouraged to exercise during and after treatment. We want to minimize the decline in general fitness and strength. It can reduce stress and improve mood, and we know just having a diagnosis of breast cancer is stressful. Cancer treatments can reduce your immune system function, and exercise has been shown to boost it. We'll talk more about fatigue in a moment, but we know exercise can give us energy. Sleep can be disturbed for many reasons after being diagnosed with cancer. Exercise has been shown to improve sleep. But perhaps do not exercise shortly before going to bed, as it can wake you up, so to speak. And finally, there's a growing body of evidence to support improved survival rates amongst cancer patients who exercise. The cancer patient should start any new activity or exercise program gently and progress slowly. Monitor how you feel with exercise and adjust accordingly. The goal is to eventually do 30 minutes of activity a day or 150 minutes per week, as recommended by Canada Fitness Guidelines. But know that it can be done in smaller increments, such as 3 10-minute walks in a day. To help you be successful, choose an activity you enjoy. Walk with a friend. Do a group class for support and camaraderie. Consider Tai Chi or yoga, which are gentler forms of exercise. Consider aquasize if you have joint issues. There are also a lot of community programs specific to breast cancer, so look online or ask your healthcare provider. If you're not an exerciser, then clean the house yourself, do some gardening, take the stairs. This might be a lifestyle change for some of you, and change takes time, but try to start. The next thing we're going to talk about is cancer-related fatigue. Fatigue is reported by almost all cancer patients at some point during or after treatment. Most people report an improvement in fatigue levels 3 to 6 months following completion of their treatments. But for some, it can be longer, and it can vary in severity and it can change day to day. Cancer-related fatigue differs from just feeling tired in that it affects your ability to carry out everyday activities. You may find it hard to do your normal chores or job, and it's important to know that it does not respond to rest or long naps. In fact, resting too much may make you weaker and more deconditioned. But guess what does help? Exercise, exercise, exercise. Exercise has been proven to help reduce fatigue. That is why we encourage you to be active as able during and after treatments. There are some online resources to help educate you a bit more on this topic and offer some strategies to help you manage. The first one, Cancer Care Alberta, has several links to excellent resources on fatigue. The second one, called mycancerfatigue.ca, is a more comprehensive resource with lots of good information. And finally, Dr. Mike Evans has a short 10-minute video that summarizes simple ways to address this problem. You can look it up online. If your fatigue is significant and not improving, you should speak with your doctor. There are many factors to cancer-related fatigue, and some of them may need to be medically addressed. Next, we'll talk briefly on axillary web syndrome or cording. This is when tight bands form under the arm or down into the arm or chest wall on the side that is being treated. You can see this on the photo with cords under the arm and in front of the elbow. But remember, the severity of cording varies from person to person, and it may look different from this photo. If you have cording, you may experience discomfort and limitation of movement when reaching out with your elbow outstretched. Axillary web syndrome is more commonly seen in the early weeks after surgery. We bring it up in this talk as it sometimes comes on with radiation therapy as well. The good news is cording does resolve with regular, gentle stretching. You can do 3 to 5 gentle, sustained stretches, holding for 15 to 30 seconds, 2 to 3 times per day. Often, improvement is seen week to week, but if you're not seeing improvement in the cording after 2 weeks of exercise, you may want to see a physiotherapist in your community. The last thing we're going to discuss is lymphedema. Lymphedema is swelling caused by damage to the lymphatic system. Swelling can be in the arm, hand, breast, or chest wall of the surgical side. The good news is that most breast cancer patients will not get lymphedema. Research reports the risk somewhere between 1 to 20%. The percentage varies depending on the research papers you read. Lymphedema often presents in the first 1 to 2 years following treatment, but it is a lifetime risk for all breast cancer survivors. So it is good to be informed and to understand your own personal risk factors. Some of these risks are modifiable with lifestyle changes. The biggest risk factor is having lymph nodes removed. The more nodes removed, the higher the risk. So if you've had a sentinel node dissection with just 1, 2, or 3 nodes removed, your risk is minimal compared with someone who's had an axillary node dissection and maybe 10 or 20 nodes removed. Many of you already know the number of nodes removed, and if you don't, ask your surgeon. Other known risk factors include receiving radiation treatment, having a history of local infection, and obesity. These are all factors that challenge or stress the lymphatic system. So there are things you can do to help reduce your risk of getting lymphedema. Again, depending on your personal risk factors, you decide for how long you need to practice these things. A shorter time for those with fewer nodes removed, and perhaps a lifetime for those with many nodes removed and have other risk factors. Take good care of your skin. An open area in the skin can lead to an infection, and we know infection is a risk factor. Avoid injury to the skin by wearing long sleeves and garden gloves when out in the garden. Use repellent to avoid insect bites, sunscreen to avoid sunburn. Use oven mitts to prevent burns. Don't let this cat scratch you. Wash and moisturize hands well to prevent dryness and cracks. And if you do get an open area, wash it well and perhaps apply an antibacterial agent and a bandage. We want you to be active and exercise, but don't hurt yourself. If you're lifting weights or starting a new activity, start slow and progress gradually. Strive for an ideal body weight and seek support in the future as needed. Those people with higher risk factors should use caution with heat sources. Don't apply a hot pack to the limb. Limit time in hot tubs and saunas, and monitor the limb for swelling. If you're in a hot climate, allow some periods for your body to cool off by getting in the shade, air conditioning, or the water. Avoid constricting the arm. Use your unaffected side for blood pressure or blood work if able. Loosen a tight watch strap or wear it on your other wrist. A well-fitted bra with a wide band is helpful. Long air travel can cause fluid retention for some, and for those people who do not have lymphedema, guidelines say that you do not need to wear compression. But again, assess your own personal risk factors and seek guidance if necessary. Remember, infections can cause cellulitis, which can lead to lymphedema. If you have an infection, you need to seek medical help. An infection presents with some or all of these symptoms: redness in the skin of the arm, chest, or trunk on the treated side, warm to touch, it may be tender or painful, and there is swelling. See your doctor that day. Systemic means that the infection is spreading through the body. You may start to feel unwell and have a fever. This is a medical emergency. Go to your local hospital. Unfortunately, there is not a cure for lymphedema, but there are ways to manage it and keep it under control. So if you have swelling in that arm or trunk, see your doctor and get referred on to a physio or occupational therapist with lymphedema training. The take-home messages are: do your exercises to keep the shoulder and chest wall flexible. Be active and exercise as part of your life. Take care of problems early and ask for help. There are rehabilitation specialists familiar with breast cancer-related problems if you or your healthcare provider have questions. I hope you have found this presentation helpful, and all the best in your recovery. Need more help? Here is a list of resources you can access in Alberta.